Hello friends, this is Dr. Alifiya Bapai. I'm a gynecologist at Selfisolation Hospital, Mumbai, and will be talking to you on COVID-19 in pregnancy and breastfeeding. So basically you need to know what is COVID-19. As we all know, it's a viral infection and it spreads through droplet contact. When a patient coughs or sneezes, the virus is shed in the secretions, and the droplets being heavy, they fall up to a distance of 3 feet. When you come in contact with these droplets, virus enters through your mouth, nose, eyes, and even the urogenital tract and can cause symptoms. The viral droplets are heavy, and since they fall up to 3 feet, we advise social distancing up to 3 feet, that is 1 meter minimum. Ideally, we advise 6 feet distance. It causes symptoms like cough, fever. It can cause chills, basically flu-like symptoms, body ache, sore throat. It can cause loss of smell and taste, and it can cause shortness of breath, difficulty in breathing. Atypical symptoms like diarrhea are also seen, and in severe cases, even chest pain. The symptoms can range from mild to severe illness, and they appear 2 to 14 days after exposure to the virus. You must also know that around 40 to 60% of people infected with COVID are asymptomatic. They don't even know that they're carriers of the virus, probably because the immune system is strong enough to fight the virus and they do not develop any symptoms. Now, if you ask, can I plan a pregnancy during these times of COVID? Well, yes, it's a personal choice, of course, but yes, you can plan a pregnancy. The risk of you acquiring an infection in pregnancy or developing symptoms or worsening of symptoms when you acquire the infection is not increased just because of your pregnant state. Your risk is same like that of any healthy adult. There is no risk of miscarriage or even birth defects or preterm labor. Of course, in high-risk cases like diabetes, those who have hypertension, cardiac diseases, those who are on immunosuppressive medication, those who are above 35 years of age, we generally ask them to wait for a period of 3 to 6 months. What is most important now is that you enter into pregnancy with the best state of immunity, and that can only be achieved with a healthy lifestyle. Now, what do I mean by this? Religiously, you have to wake up every day in the morning by 5:36. 6 to 7, you will do 1 hour brisk walking as an exercise. If you can't go out during times of COVID, it's best to exercise at home, things like yoga, and then you have core exercises. All this helps you to maintain a healthy body. By 8 o'clock, you'll have breakfast, let's say chapati or paratha or oats with fruits and a glass of milk or a mug of juice with oats. That's breakfast, not bread and cheese and butter and mayonnaise. Then by 10 o'clock, you have a boiled egg, or you can have any pulse. By 12 o'clock, you'll have fruit, basically banana being a good fruit. By 1:30, you'll eat lunch. So more of chapati, less of rice. Chapati can be made out of either wheat or bajra or jowar. Then by around 5 o'clock, you have any salad or beet carrot juice. 8 o'clock dinner. By 7:38 is dinner. Dinner again is light as compared to lunch. And after dinner, you'll have, say, a glass of milk with dry fruits like almonds, pistachios, walnut, or dates, and in bed by 9:30. All right. No junk food, sandwich, pizza, burger, chips, wafers, chocolate cakes, ice creams. So basically, early to bed, early to rise, and timely right meals. This is absolutely important for you to maintain a basic immunity level. No amount of medicines can help you boost your immunity if you don't take care of your lifestyle. Of course, we give vitamin supplements like folic acid and vitamin D and vitamin C prior to planning a pregnancy. HCQS as a medicine, initially when during the initial months of COVID, when HCQ has come out, people were taking it left, right, and center. But HCQS doesn't prevent you from acquiring the infection. It's generally reserved for patients who are COVID, and it helps you to prevent any inflammatory storm. The other thing important is that if your sexual partner is having any symptoms of flu, cold, cough, fever, it's best not to indulge in any sexual activity during that time. Now, supposing you are pregnant. So the first trimester, the first 3 months of pregnancy, you will call your treating doctor who will then advise you as to the further course of action. Generally, in the first 3 months, we do not call you for any checkups. We call you at the end of 3 months. That is when your checkup, your blood test, your sonography, all is done in one visit to prevent your multiple visits to the clinic. But in case if you're high risk, in the sense if you've had previous ectopic pregnancy or if you've had recurrent miscarriages, or you're above the age of 35 and you have comorbid conditions like diabetes or blood pressure, you may be called earlier. So when a doctor calls you to the clinic, remember the risk of the pregnancy complications would outweigh your risk of getting exposed to the virus at that time. Checkups and essentials, as I said, always done at that particular visit. You are either asked to come alone or you're accompanied by a single person, not more than that. In the second trimester, that's generally at around beginning of the 5th month is when we do the anomaly scan. At that time also you'll have an online consultation. We start you with, in the second trimester, we start you with supplements like iron and calcium. And in the last trimester, when we call you in the 7th, 8th and 9th month for regular checkups. And in the 7th month, we also have hospital registrations. And these hospital registrations are all online. You don't have to personally visit the hospital. The vaccines given in pregnancy, of course, one is a tetanus. The other one is the 3-in-1 vaccine, which includes tetanus, diphtheria, and acellular pertussis, and of course, the influenza vaccine. This influenza vaccine can be taken anytime in pregnancy. We generally start from the second trimester, but you can also take it in the first trimester if the benefits outweigh the risks. Influenza is just providing you cross immunity against COVID. Taking the influenza vaccine does not guarantee you not developing COVID infection in the future. Now, supposing you develop a fever, you don't need to panic, and remember, not all fevers are COVID. You have to ask and call your treating doctor who will then treat you accordingly. I would want you to try a lot of home remedies during this time of if you develop a fever. Have lots of warm water, warm soups, keep yourself well hydrated. You can have turmeric milk, you can have turmeric with honey. These are all good things to do. What are the safety measures that you'll use? Of course, when you visit the clinic, you will wear your mask, you wear proper eyewear, gloves, you'll maintain social distancing, avoid fidgeting with your mask, avoid moving about the clinic. Now, most important thing about the mask is when you're wearing a mask, see that first you wash your hands. Now, normally when you wash your hands, many people have seen just wash like this and you're done. Sorry, this is not the way you wash your hands. When you wash your hands, you have to wash the palms, then you wash the back of the hand, you wash in between the fingers, you wash your nails, and you also wash your thumb and the wrist. So you have to wash your hands in running water for at least 40 seconds or minimum 20 seconds. You will inspect the mask for any wear and tear. If there are wear and tear, of course, you're not going to wear that mask. You have to change the mask. You generally choose a mask which has a pin at the top. The pin helps you to fit the mask snugly in this area around the nose and the cheek. When you wear a mask, you have to be absolutely sure that there are no air pockets from the sides or from below or from top. If there are air pockets, the purpose of wearing the mask is lost. Wear the mask in a manner that it covers the nose, the mouth, and the chin. Don't leave any area exposed. Do not touch the front of the mask, and when you remove the mask, you have to remove it from the back and then dispose it off in a bin with a closed lid. And of course, wash your hands again after disposing the mask. As I mentioned, don't wear masks which have a lot of wear and tear. Do not reuse a mask. Okay, the N95 mask can be used for around 5 washes, and the normal 3-layer surgical mask we generally recommend is use and throw. Avoid putting it on tables and surfaces where other people can come in contact with. Most important is do not touch the front of the mask because that is what is acting as a filter. So when you touch the front of the mask, you're actually depositing the virus on your fingertips again. Do not put your mask down when you want to talk to anybody. See that it is always covering the 3 areas, the nose, the mouth, and the chin. And also remember one thing is wearing a mask alone does not protect against COVID. Despite the mask, you have to maintain social distancing of minimum 1 meter, that is 3 feet. Now, what are the precautions that you will take? Of course, as I said, diet is extremely important in pregnancy. You need to eat every 2 to 2 hours. Pregnancy is not breakfast, lunch, and dinner. By 7:30, you eat breakfast like chapati or oats, okay, or paratha. 10 o'clock boiled egg, 12 o'clock any fruit. 1:30 lunch, split your lunch, little at 1:30, little at 3 o'clock. More of chapati as compared to rice. Vegetables, chicken, fish, sprouts, pulses, soya, rajma, everything you can eat, but with roti. Then by 5:36, you can have a bowl of moong or chana or beet carrot juice or any salad. By 7:38 is dinner, again roti with whatever vegetables or non-veg. And then by 10 o'clock, you'll have a mug of milk with almonds, pistachios, walnuts. You'll grind these 3 dry fruits and 2 nice tablespoons you'll put in milk and have. This is how you eat in pregnancy every 2 to 2 hours. In the first trimester, there's a lot of nausea. Always remember that this nausea, if you don't eat, will aggravate. If you eat every 2 to 2 hours, you're going to keep it under control. Remember to wash your hands after coughing, sneezing, when you're handling any patient who's sick or any person in your house who's sick, before and after you prepare food, before you eat, after you use the toilet. You wash your hands if you feel they're visibly dirty. When you cough, don't cough in the open. Cover your mouth and your nose when you're coughing. You can either use your hands or tissue paper. After discarding, you must wash your hands. Or you can also cough or sneeze on your elbow. Avoid contact with people who are sick and having cough and fever. Avoid non-essential travel. Preferably work from home. Avoid gatherings. Avoid mates coming home. And of course, use the mask properly. There are 3 basic breathing exercises, and that's pranayam, which I would want you to follow. One exercise is you would bend your index and the middle finger. You will close your nostril with the thumb. You'll breathe in through one nostril for a count of 8, and then breathe out through the other nostril for a count of 8. Then breathe in through that nostril for a count of 8 and breathe out through a count of 8 through the other nostril. So in, out. That would make one cycle. That you can do around 6 to 10 cycles. The other exercise is where you breathe as if you're breathing from your throat and you get that ocean kind of a sound. And that you do around 10 to 15 reps, deep breathe in and out. Okay. And the third exercise is where you breathe in through your nose and you breathe out with a sound. So this also around 10 to 15 reps. And this is how you do your breathing exercises. This is absolutely essential. People don't know how to breathe. Okay, a lot of people use their abdomen and diaphragm to breathe instead of using their lungs and the chest wall. So basically you have to breathe so that air enters into the base of the lungs. This helps you to keep your lungs open, especially in pregnancy when there's a lot of shortness of breath. When the baby comes up and pushes the diaphragm up, it reduces the lung capacity. So these exercises help you to expand the lungs and reduce the shortness of breath. These are some questions which are commonly asked is, should I avoid shaking hands because of the coronavirus? Of course, you will avoid shaking hands. There's no doubt about it. Will wearing rubber gloves help you against the corona infection? No. Now, what people do is they wear gloves thinking that's going to protect them, and then they keep touching their face and their eyes and the nose. That's not going to help you. Even if you're wearing rubber gloves, the virus can still stick onto the rubber glove. The rubber glove is not a repellent to the virus. It's not a sanitized surface. So basically, even a rubber glove, you have to keep washing. So best is just wash your hands regularly. Should I wash my clothes in a washing machine? Yes, of course. But if you're washing clothes of a person who has fever or who's diagnosed with COVID, it's preferably to wash them separate at a temperature of around 60 degrees. Can coins and notes act as a means of transfer of corona? Yes, there is evidence, but not concrete in the sense that there's very, very minuscule risk of spread of virus. But yes, the coins and notes can act as fomites to transfer the virus. So it's best that you deal directly in the form of Paytm and you don't need to actually use money. And if you have to, coins can easily be sanitized with any sanitizing liquid, whereas notes, you can put them in a pouch and keep it away for 48 to 72 hours and then you can use. In terms of vegetables, the only thing that you need to do with fruits and vegetables is when you take them, you will wash each and every fruit and vegetable without peeling it under running water for at least 2 to 3 minutes. And after they are washed, you will wash your hands again. Again, you can take a tub of water and leave the fruits and vegetables in it for around 20 to 30 minutes and then wipe and put it in the refrigerator for storage and wash your hands again after that. Do not cut, peel, and then wash. They have to be washed before they are cut. And then using sanitizers is immaterial. In fact, it's a health hazard to you if you use vegetable and fruit sanitizers. You don't need to scrub it with scrubbers or use soap or use sodium hypochlorite or chlorine. COVID testing is recommended for all pregnant women across the board. This is prior to hospital admission or once hospitalized, where the hospital would then send the sample. This is important to prevent spread of the virus in the hospital from the patient. The validity of the test generally varies from hospital to hospital. Generally, it's around 48 hours to 7 days or sometimes even 14 days. Now, what is most important in this testing? You have to self-isolate yourself for minimum 14 days prior to testing for the test to be even valid. Now, if you've not isolated yourself and you've been up and about, you test yourself today, it may come negative. Immediately tomorrow, the test can come positive. So it's important for self-isolation before the test. The swabs are taken generally from the nose and mouth and the PCR test is done. We have newer tests coming in now, which is the blood test, which checks the antibody levels. So basically it tells you about your immune status and it's generally done for healthcare workers. Now, babies born to COVID positive mothers are of course tested. Okay, they either tested at birth or at 48 hours and then repeat testing is done again after 7 days. Now, labor. Now, when you go into labor, the common question is, should I deliver in the hospital or can I manage at home? Sincere advice, hospital delivery is way safer than home delivery. Obstetrics and childbirth is one thing where sometimes it gets unpredictable. Even if your pregnancy has been absolutely normal, God forsake, if there's any complication in labor, you will have to be shifted from home to hospital and precious time is lost. In the hospital, any complication is quickly sorted. In obstetrics, every second counts. What precautions would you take in labor? Of course, you will wear a mask, you and your partner both. Both of you would be given a single room. You would not wander out of the labor room. You would be given nasal oxygen and you'll have minimal contact with the others. The route of delivery is immaterial of the status of COVID. You can be given a trial of natural vaginal delivery, or it can be induced labor and you can be given a trial of vaginal delivery. Cesarean is indicated only for obstetric indications. The discharge of the patient depends on how comfortable the patient is in terms of pain, breastfeeding, bleeding. Once she is comfortable, you can go home, be it 4 hours or be it 24 hours. The risk of transmission of the virus from mother to child can happen either through placenta or breast milk, but the risk is extremely negligible. All babies born to COVID mothers are doing extremely well. Post-delivery, yes, breastfeeding. If you're COVID negative, of course you would do. But what if you're COVID positive? Yes, you will feed your baby. In the hospital, supposing you deliver in the hospital and you're COVID positive. After you delivered, you're fine, you want to go home, you're asymptomatic. Yes, the hospital will send you home, will not keep you till you become negative, provided you have facilities for home isolation. In the sense, you have a single room with a bathroom attached, so then you can be allowed to go home and isolate yourself. But supposing you don't have facilities for self-isolation, or if you're symptomatic, you have fever, cough, or cold, or you have another child where you feel distancing is not going to be possible at home, then you would be kept admitted in the hospital. Fetal vaccinations, of course, you can give as per the timely schedules. Now, what is home self-isolation? There is a lot of mental anxiety in mothers, especially COVID mothers, all right, who deliver in their COVID positive state. But always remember, it's just a matter of 2 weeks. Even when you go home, you don't have to panic. The only thing you have to take care is of your baby. There is nothing else that you need to do. And taking care of the baby is not rocket science. The baby's reflexes are all intact. Okay, the sucking, the rooting, the swallowing, baby learns these reflexes and is born with these reflexes. All that you need to do is latch the baby properly. You latch the baby, the rest of the work the baby does. Okay, now handling the baby, of course, you will wear a mask at all times. You have to change your mask every 8 hourly, and if it is wet with secretions, you have to change it immediately. Before you dispose of your mask, you have to disinfect it with 1% sodium hypochlorite. And if that is not available, you can use your normal household bleach, where 1 part of bleach and 3 to 4 parts of water will give you the desired concentration. You need to eat well. You need to maintain the healthy 40-day diet. You need to hydrate yourself well and exercise, especially pranayama. See that you hydrate yourself well, because there's a myth where some people don't drink a lot of water in the fear of bloating. But that's a myth. See that you have lots of warm water. As far as the mother's massage is concerned, it's okay if some family member can do it. If not, do not call anybody from outside. And the baby massage is best if the mother does it, because the whole idea of baby massage is to establish mother and child bonding rather than somebody else coming and massaging your baby. The supplements that we give generally is, of course, iron, calcium, vitamin C. HCQS can be given in breastfeeding, provided it is required when you're developing symptoms or you're showing any inflammatory signs. The warning signs that you will get to the notice of your doctor is if you're feeling breathless, if you're developing fever, or if you feel your baby is having a grunting sound, a baby is turning blue, is not accepting feeds, is getting lethargic, you have to let your doctor know. At that time, you may be asked to get readmitted. The isolation would generally end 14 days from testing or 10 days from development of fever plus 3 days that we keep as buffer. No need to repeat the sampling for testing for COVID. Your isolation would end irrespective of the COVID status after 14 days, because viral shedding is prolonged for a long time. Sometimes it's 28 days or even 6 weeks, but your infectivity is markedly reduced after 14 days because the replication potential of the virus falls significantly. This is the ruling from the Ministry of Health and Family Welfare, where you do not need to repeat the sample before ending isolation. As far as caregivers is concerned, of course, the person taking care of you will serve you in the room. You will not come out of the room. The person will wear gloves, mask, cap, and proper footwear. Okay. He will wash his hands before and after treating you, before and after serving you. The vessels that you use can be washed with soap and water and reused, and then the caretaker will have to wash his hands again. That basic hygiene has to be done. Coping with stress, particularly with the elders and children at home, where this lockdown has caused them to get very aggressive and there are a lot of tantrums that children are throwing. The best way is to form a schedule in the house. Your sleeping time, your play time, your television time. And best with television is, please do not keep watching COVID news. Watch good media, watch good television. Thus, we just need to fight the virus and hope you all stay safe. Thank you.